I'm Dr. Glenn Barnes from UT Tyler School of Nursing, and it's time to take 5. Today we're going to be talking about first aid kits. Now, first aid kits come in a variety of sizes and purposes. We're going to be talking about the different levels. We're going to discuss what can go into them depending on your environment. And we're going to talk about the process from actually triage to what we call prolonged field care. So, your kit levels. First is just a boo-boo kit. This is just a basic first aid. It's got some bandages, maybe something to clean a wound with, a couple steri strips. Very simple, easy kit. The next is what we call an IFAC, or an individual first aid kit. From there, you progress to a dedicated trauma kit, and then a medications kit. So your boo-boo kit, again, minor injuries. Small, easily accessible. You don't want to have to go digging through everything just to put a Band-Aid on a small cut. When it comes to Band-Aids, get quite a bit of them in different varieties, different sizes. Some kind of antiseptic. Either be a Neosporin type or some kind of a liquid like hydrogen peroxide. Steri strips will help pull wound edges together if it's a little more serious. And you can even bring a small amount of duct tape. I found that saran wrap and duct tape have wonderful needs in a first aid kit. So whatever you think that need is, look at the space in your container. If you could fit something else in that container, then put something else in there. Mini pads, you hear a lot about. There's a little bit of pros and cons about things like that because they are designed to absorb blood, that they think that the pool might actually keep a wound going. I've not really found that to be true. Personal experience, I've found that they work just fine. They're very thin. You could put a couple in there, reinforce the dressing, they'll work just fine. And if you're going to make a boo-boo kit, make several. Put them in your house, your car, your backpack, just wherever you think you could be where you might get hurt or someone else might get hurt, and you might need just a Band-Aid. Next is an individual first aid kit, or your IFAC. This is primarily trauma-based. So your main priority is going to be hemorrhage control. It should have a tourniquet. It should have some type of a gauze or dressing, or both. And you want to really add it up. You can get tape, shears, very good. And there's some very good pre-made kits. Now, again, disclosure, I'm not working for these people at all, but it's a company called Tactical Medical Solutions. I love their stuff. I've used it in Iraq, Afghanistan, Africa, all over the world. They make really good, high-quality stuff, and it's honestly not that expensive. So you can go from there or North American Rescue. If you're going to gauge an IFAC, base it off the military IFACs. Why? Because the military is really good about getting hurt, and because of that, they're really good about taking care of people that are really good about getting hurt. So if you want to buy an off-the-shelf one, find one that is based off a military structure. So your trauma kit is a large standalone kit. It should be able and equipped to handle multiple casualties. And you want to treat more severe injuries with that. So you want to talk about having SAM splints and ACE wraps to treat orthopedic injuries. You want to have some diagnostic equipment in there. This kit is large enough for you to put a stethoscope in. You also want to have battle dressings, burn sheets. Again, SAM splints we talked about, ACE wraps, duct tape, some kind of cling. Cling works great if you have an abdominal evisceration. You have insides trying to come outside. You could put the cling over that, and it maintains a moisture barrier to keep the guts wet and moist instead of drying out, because guts do horrible when they get dry. They also work for patching up chest wounds that are leaking air, and it's good for layering over burns. One thing to consider is to have what's called throw packs, or you put several bandages in a Ziploc bag or some kind of bag that you can hand off to people and get them to start taking care of people as well, especially if you have a group of people that have been trained in first responder care. And at this point, I want to really emphasize that if you have not had the Stop the Bleed course, please, please, please find out who's teaching it and get the Stop the Bleed course. You get a nice little certificate. More important, you get the knowledge to stop bleeding that could end up causing someone to die from bleeding to death, which is the #1 reason of preventable deaths from a traumatic accident or injury. Other things you can think about is a portable litter. stock it to your skill level. Don't worry about IVs. One, they expire. Two, it's a perishable skill. And we found that IVs really are not the best thing for wilderness type medicine. If you're losing blood, you need blood. You don't need water. Now, your medication kit. This is very, very person specific. You want to keep it in an airtight container. You want to be able to monitor expiration dates. So every time you open the kit, and I suggest you open it up once a month, look at the expiration dates. Have a list of those expiration dates on the outside of the container so you can just take the container, look, and see if anything's expired. If it is, change it. You have to be careful of allergies. If you're going to give these to other people, you have to be very, very careful that you're not going to cause more harm by giving them something they're allergic to. You want to be able to protect this from the heat, cold, impact. Putting this in the trunk of your car in August in Texas might not be the best thing for medications. For you, you would want to have like 5 days worth of your medicines in your kit. You want to have your basic over-the-counter drugs, pain reliever, anti-inflammatories, antidiuretics. When it comes to antibiotics and stronger pain medicines, don't break the law. Understand the laws with having prescription drugs on you. Now, if they're your drugs and you got a prescription for them, great. Don't give them to other people. Because if you do, you're now dispensing medicine. Unless you actually happen to be a provider and have prescriptive authority, then by all means, do with what is in your scope and your skill level, and you are legally allowed to do. Any questions?